Next on the procedure is okay. Well, here he comes now. Is Paul Heffner, who's going to talk about, okay, finding your way. How do you deal with this as a human being? And we're ready for you. You can use the hand mic, or you can just speak, whatever's easiest for you.
Probably just speak directly. Maybe. Okay. So, which way? This way. So, good afternoon. Thank you for allowing me the opportunity to be able to speak with you today. My presentation is going to be a little different from some of the wonderful medical knowledge that you've gotten today from our doctors. It's going to be more about how are you going to cope with finding out something is amiss, something is wrong, you have abnormalities perhaps with your eye, and now you're going to be dealing with how to navigate the system. Maybe? There we go. So my name is Paul Heffner. I'm a social worker. I work in glaucoma at Wills Eye Hospital. I'm relatively new. And a little bit about what a social worker is, because I think there's a lot of stereotypical ideas. Social workers are, especially in a medical facility, are master's level professionals. We are trained to help patients learn how to navigate systems, learn how to remove barriers to being able to access treatment, linking people up with resources, and also master's level social workers are therapists and trained to offer emotional support, because it can be very distressing and overwhelming learning that you have a medical diagnosis. So that's definitely an important part of the work that I do. So starting out, some of you may have even been experiencing this today. After you've been screened, you're finding out something is wrong, and you're getting the news. And I think I like to encourage people as they start to know that they've been told that they are a glaucoma suspect, or that they need some sort of follow-up of some sort of medical treatment. It can be distressing and overwhelming. It's immediately anxiety-provoking to hear that something is wrong. So I encourage people to take a moment and just, acknowledge your feelings. This is stressful and upsetting. So just take a minute and sit with that and catch your breath and think about what the best way to move forward. But once you've gotten your bearings, it's time to get moving. You don't have a lot of time to sit and think about procrastinating. It's about being proactive. So once you hear the news that you are a glaucoma suspect, you want to be able to reach out to your doctor and start getting the information that you're going to need to best treat your condition. So do not procrastinate, especially something like glaucoma. The longer that you wait, the more negatively it can impact you. So you want to be proactive in your treatment. So if, for example, today you've been screened and they've said there's an abnormality, something's amiss, talk to your primary care doctor. Get a referral to an ophthalmologist. And like I said earlier, don't procrastinate. Make sure you're doing this as quickly as you can. Find out what the treatment options are. A lot of probably the information that you're hearing today is, medications, what kind of medications would you need, and is laser treatment an option? Or do you need to eventually have surgery? Find out what's the best option for you. You're going to want to talk to your insurance carrier. I was just working with someone this week that she had this wonderful coverage, but she didn't even have vision in her part of her package. So you're going to want to call your insurance company and find out what your coverage is for vision to determine if the treatment that you're going to need is going to be covered. If the best treatment for you is going to be medications, are the medications that you're going to be being treated with prescribed, are they covered? And what are your surgery options? So definitely, it is frustrating and aggravating to contact your insurance company. I'm sure many of us have been in that situation before, but it is important to try and be patient and diligent to do it. So what happens if I'm not insured? So I like to just put this information out there. Contact healthcare.gov, and the phone number is 1-800-318-2596. And right now, there is a special enrollment period going on. It's sort of like an amnesty time for those people that would potentially have some sort of penalty associated with not having health insurance. Up until the end of this month, they are having a special sign-up option. So there is time until the end of April to be able to try and contact healthcare.gov and sign up for your insurance if you don't already have insurance. Also, throughout the year, there are special circumstances in which you would be allowed to sign up for insurance regardless if it's outside the enrollment period. So, you know, make the phone call, find out what the options are. And if for some reason you are not eligible for the healthcare.gov insurance options within the marketplace, your next step is going to be exploring and investigating within your state how to get medical assistance. And that can be an arduous and time-consuming event to go through the application process. So if you did find out that you are not eligible to get insurance through healthcare.gov, contact the Department of the State. In Pennsylvania, there's an application called Compass that you would be able to fill out and submit even online and get that process started, because it does take, typically, like most things, 4 to 8 weeks for medical assistance to kick in, and it can be a problematic process. So the sooner you get started, the quicker you're going to actually have the insurance that you need. So often when I'm working with people that are now starting to have visual impairment and they've lost vision, they're losing some sight, I get a lot of questions about what kind of benefits, are there any disability or coverage. So I wanted to do a couple of slides about Social Security benefits, what it is, how do I apply, you know, things of that nature. So first of all, I want to just clarify supplemental security income, SSI, what that is versus SSDI. Now, I have a slide coming up that will kind of discuss SSDI, but supplemental security income is a federal income supplement program funded by general tax revenue. It is designed to help aged, blind, and disabled people who have little or no income, and it provides cash to meet basic needs for food, clothing, and shelter. And these applications are accessible online. It's pretty easy. If you even just do a Google search, the website comes up, and they also do have a phone number in case you aren't readily utilizing the internet on a regular basis. You can access this information over the phone. Now, the difference between SSI and SSDI, or Social Security Disability Benefits, is that SSDI, you would have had to establish some work credits. So you would have had to have worked in a job covered by Social Security. And then you must have a medical condition that meets the Social Security definition of what a disability would be. So often that means that you're going to have to get a diagnosis signed off by your physician, whether it's a specialty or a primary care physician, depending on what the disorder may be. So it's a monthly cash benefit to people who are unable to work for a year or more because of a disability. So that's just a little bit of the difference between SSI and SSDI. And once again, it's one of those processes that will take some time. Sometimes 120 days can be an average wait for some of these benefits to kick in. So the sooner you get down this road on getting this process started, the sooner you might be eligible to receive these benefits. So whenever you have a physical health condition, you're going to be dealing with entities, whether it's medical professionals, Social Security, insurance companies. Just some tips, if you will, on how to interact. Ask questions. It's confusing, it's frustrating, and you may be getting misinformation. So don't be intimidated. You need to get the right information. Don't hesitate to be assertive, and get the information you need. Be willing to wait. I literally, this past week, was contacting an insurance company, and I kid you not, I was on hold for over an hour. And unfortunately, that's just some of the process that you may experience as you're going through navigating these systems, but do not get discouraged. Be patient, be willing to wait, and be willing to talk to a supervisor. Of course, you want to be respectful, and you typically will get better service if you're polite and what have you, but you definitely want to talk to the right people. If you're not getting the information that you need, I encourage you to escalate the call, talk to a supervisor, and get the information that you need. And something I do as well is I make sure that I take down names. It's not trying to be punitive or to create a hostile interaction with whoever you're speaking to, but oftentimes you talk to so many different people, and it's in a call center. You want to be able to say, I spoke to Henry on Thursday at 12:30, and this is the information that I'm getting, and now I'm getting a different information from you, Rhonda. You want to be able to sort of hold people accountable to what you've been told, because oftentimes you're going to get conflicting information, and it's frustrating. So when we're approaching any sort of health treatment, I encourage people to think about the actual logistics of what it looks like, and to be honest with yourself on what you're willing to do. Part of glaucoma treatment is often around medications and taking the drops, doing them consistently, and doing them exactly as the doctor says. But, will I actually follow through and take the medications? And if not, can I talk to my doctor? Is laser an option for me? If I'm not someone that is really great about taking my eye drops or my medications on time, and if I am being avoidant, being honest about, hey, I haven't been going back to my ophthalmologist in a long time. Maybe I'm avoiding that experience because it raises our anxiety to think about some of our health conditions. And I think that's a really natural occurrence, but we have to be cognizant and honest with ourselves. What are the consequences of me not following through with my medical care? And if I am not great about remembering to do things like taking my eye drops, what have you, who can offer me support? Maybe it's about learning how to set an alarm in my phone, or talking to a husband or wife or daughter, whoever. Who can I talk to around this that's going to be able to help me navigate? So also financial struggles, what can I afford and what needs to be looked at? When a health crisis or a diagnosis that's going to impact us, maybe we need to reevaluate our budget. Maybe it's no longer feasible to be going to the movies every week because I have to be planning ahead for my copays. It's about having those kind of discussions within the family, and also being really upfront with what you're willing to do, what sacrifices you might have to make within your finances to be able to cover some of these upcoming expenses. So I've experienced a lot of people working in this position as a medical social worker that are really reluctant to ask for help, and I really encourage people to do that. It's only to benefit you, and it's not. It is no indication of your character if you need clarification. It is truly okay to get the support that you need, and doing things, navigating healthcare is frustrating and it is hard. So I say utilize resources, be willing to be vulnerable, take some risk, and ask the questions that you need to ask to be able to get the answers that are going to be helpful to you. Give yourself permission to get support. So as a social worker, finding resources, I feel like I spend most of my time just trying to find resources, and Google and I are like best friends. We hold hands, we skip in the park. So I encourage you to utilize things like Google to be able to find, just typing in a search like ophthalmologist, if you're looking for a doctor or whatever is going to be helpful. Something I give a caveat to that, though, because not every resource is a good resource. You have to kind of like do some investigating around some of the things that you're going to find, but be determined. You know, all of this is just taking some time, patience, and diligence to get the resources and information that you're going to need. And I say this with the most sincerity: social capital is priceless. If you have a resource that is helpful, please share it with others. I think that that's the only way that some good resources get the attention that they deserve, is because it's word of mouth. So if you are aware of an entity that has been really wonderful, that it would be helpful to other people, share it within the community, and get to know the community. Find out what's out there, and like I said, reliable resources are seriously golden, so share them. That's all I have. Does anyone have any questions? Thank you. I am out in the lobby for a little while if anybody wants to try and touch base with me about something. Okay, thank you.
And thank you very, very much.